So today we're going to discuss about the capsule structure of the shoulder and what disorders can happen to a shoulder capsule.
Hi, I'm Awina D'Souza, Masters of MSK and Sports Physiotherapy, and I also help people above 50 to regain confidence and strength.
So the topic for today will be periarthritis or frozen shoulder. And what is frozen shoulder? What are the common signs and symptoms? The age that it is seen in, different various treatment techniques that can be given. So a person demonstrating frozen shoulder is characterized by pain and significant reduction in the movements of the shoulder. This is commonly seen in women, especially over the age of 60, not neglecting the fact that it doesn't happen to men, but preferentially happens to women more than men. Frozen shoulder are of two types. One is a primary frozen shoulder and then is a secondary frozen shoulder. The primary frozen shoulder is also called as an idiopathic frozen shoulder, in which the cause of it is unknown. However, the secondary frozen shoulder has three reasons. One is external, the internal, and the systemic. The external consists of a trauma or a fall on the shoulder. The intrinsic could be any kind of fracture or rotator cuff degeneration, and the systemic could be anything like diabetes or thyroid. It is known that diabetes is one among the prevalent causes or predisposition for frozen shoulder. Frozen shoulder progresses over three different stages. The first one is the freezing stage, the second is the frozen stage, and the third is the thawing stage. The freezing stage is a painful stage wherein the inflammation is settling in. The frozen state is when the shoulder becomes stiff, and the thawing stage is a resolution stage. The medical approach involves manipulation under anesthesia, wherein the doctor would apply a local anesthesia around the region and manipulate or break over the fibrous structures which has happened over the capsule. The second way of treating the frozen shoulder is conservative management, that is physiotherapeutic approaches, which I'll be showing you with simple exercises. Treatment plan of frozen shoulder is formulated based on the irritability or how painful the shoulder is. It mainly consists of three phases: higher irritability, moderate irritability, and the low irritability. So frozen shoulder is typically characterized by restriction of movement. You can see in this image, I'm unable to lift up my hand sideways with a lot of pain. This is mostly seen in the freezing or the frozen stage, wherein the movements of internal rotation or trying to lift up my hand or even reaching towards my head is unable. You can even see this even restriction in lifting up my hand straightwards. However, this is not affected to a lot. For the treatment, we can come up with a rod like this. This is very helpful in the initial phases of frozen shoulder. It will help to increase and enhance the mobility of the joint. Make sure to do these exercises in pain-free limits and also applying heat pack before starting. In the second phase, we can start off with resistance training, but however, it would be isometric. Use a wall like this and push your hand in these directions. You can train your flexors, your shoulder abductors, and the shoulder extensor muscles. All these are isometric training muscles which will not cause or increase the pain in your joint. This is the last phase of frozen shoulder, wherein you can start training and strengthening the muscles. This is also a lower irritability phase of frozen shoulder. I'm using your dumbbells. You can even use flexi bands. Make sure that you are using dumbbells and flexi bands according to the strength that your shoulder can take. I have trained over here my abductors, my flexors, also the scapular stabilizers because it can get affected, and the rotator muscles like the external rotator muscles, also the internal rotator muscles which are not shown in this. Hope you guys have enjoyed and taken back lots from this session. Please like, share, and subscribe for more.